Fibrinolytic drugs, also called thrombolytics, are agents that can rapidly lyse thrombi by activating plasminogen to form plasmin, which is a proteolytic enzyme that degrades fibrin and so dissolves thrombi. They are used extensively in myocardial infarction to lyse the thrombi that block coronary arteries. They are administered by intravenous infusion and probably cause reperfusion in about 50% of arteries if given within 3 hours. Rapid administration of a thrombolytic agent after infarction is more important than the choice of agent. Although trials have shown that percutaneous coronary intervention is superior to thrombolytic therapy when it can be done within 30 minutes of first medical contact. The first thrombolytic agent we will talk about is streptokinase. It is not an enzyme, but it binds to circulating plasminogen to form an activator complex that converts further plasminogen to plasmin. Alteplase is recombinant tissue-type plasminogen activator. It does not cause allergic reactions and can be used in patients when recent streptococcal infections. In contrast to streptokinase, co-administration of heparin with alteplase produces added benefit but increases the risk of stroke. The main side effects of thrombolytics are bleeding, nausea, vomiting, and in the case of streptokinase, allergic reactions. This brings us to the end of this topic. Hope to catch you tomorrow with a brand new lecture.